Jordan Dollinger, Persuasive Speech, May 3rd, 2015. They are considered one of mankind's greatest medical achievements, yet people have balked at vaccines almost since the time of the first vaccination in 1796. Some may say that better hygiene and sanitation could easily prevent the spread of disease, but the germs are still around, and as long as they are, they will continue to make people sick. This is what makes vaccines such a powerful weapon. Unlike most medication which treat or cure diseases, vaccines can prevent them. Childhood immunization can not only impact one child's life, but also impact the lives of those around him or her. First, we must think of the children. Immunizations will protect children from many serious diseases. In an article titled "Childhood Vaccines Are Important to Public Health," we learn that when a child is vaccinated, the vaccine stimulates his or her immune system to produce antibodies, as if they were exposed to the disease itself. How likely is it that your child will get one of these diseases? One thing to remember is that vaccine-preventable diseases have been declining, and many of them are at an all-time low. If your child is vaccinated, you are betting that your child could be exposed to the disease. Therefore, you accept the little risk of a serious reaction to protect them if this happens. If your child is not vaccinated, you are betting that your child probably won't be exposed to the disease. If they are, then you're betting that the illness won't be serious, and you're willing to accept the small risk of serious illness to avoid the small possibility of a vaccine reaction. A recent study showed that children who had not received DTaP, diphtheria, tetanus, and pertussis vaccine were 23 times more likely to get whooping cough than the child who had. In my opinion, vaccination is by far the safest bet. Even though at the rate of diseases has declined, they haven't vanished. When asked why she vaccinated her daughter, Amanda Parker responded with, "I didn't want her to get polio or any other disease because it can screw with your life." Dr. Jane Groderud, a pediatrician, agrees. When asked what her opinion was on childhood immunization, she replied, "Childhood immunizations are top priority of pediatricians and family practitioners. Vaccines have and do prevent many devastating illnesses, lifelong complications from some diseases, and childhood deaths. Immunizations are one of the greatest advances of modern medicine." Next, let's look at the larger picture. Let's look at the larger picture of positive effects of vaccines. Vaccinating children not only protects them, but also can protect an entire community from a disease. Dr. Mark Lipstitch of the Harvard School of Public Health states, "The important concept is that vaccinating people protects not only them, but others in the community. If I am protected, I can protect others." This type of immunity is known as community immunity, or herd immunity. When enough of the community is immunized against a contagious disease, most of the members are protected from the infection due to the little opportunity for spreading the disease. According to the Centers for Disease Control and Prevention, before the vaccine for rotavirus was available, more than 400,000 people visited the doctor, more than 200,000 visited the emergency room, and up to 70,000 were hospitalized each year. Now let's look at some of the reasons why parents decide not to vaccinate their children. Some parents believe that vaccines cause autism. J.B. Hadley claims that the high rate of autism among American children has occurred in recent decades when childhood vaccines have also grown in number. Hadley states that there are 3 reasons he believes that autism is caused by vaccines. The number of vaccines given to children in the United States has expanded drastically, and up until 1969, children have only received a total of 10 shots. Today, they receive 36. Few other things on this planet that nearly all children receive have grown so dramatically during the exact time period when autism cases have exploded, explains Hadley. Second, vaccines are known to cause brain injury in some kids. The United States has paid over $1.8 billion in compensation for vaccine injury, most of which is to children and much of that for brain injury. Third, We have tens of thousands of case reports of parents reporting that their child is developmentally regressed, has stopped talking, and was later diagnosed with autism after a vaccine was issued. Dr. Growood thinks otherwise. When asked if she believes that there is any link between autism and vaccinations, she responded, "It has been definitely shown that in meta-analysis of children's health records and vaccines that there is no link between any vaccines or autism. Studies have not only been conducted in the United States, but also in Sweden, Denmark, and England. In the 1990s, a physician in England was one of or the first to state a false claim between a link between MMR, measles, mumps, rubella, and autism. About 5 years ago, this physician admitted his research was fraudulent, and he subsequently lost his medical license. Dr. McCormick states that generally scientists believe that autism is most likely results from the events in the prenatal period or shortly after birth. Autism is described as not a single condition, but rather a set of complex disorders, and it is possible that autism can have many different causes. Now that we know the benefits of vaccinating our children, let's spread the word and create a community immunity to all the horrible diseases that this world has to offer. Vaccinating children at an early age will not only be a barrier from them as tiny individuals, but also create a wall between other children and adults and the diseases."